Okay, I forgot to press record. So one more time, we're going to be reviewing for Lab Practical 3. The exercises that are going to be covered are exercise 12, 13, and 14. 12 is articulations and movements, and this also includes joints. Exercise 13 is microscopic anatomy and the organization and classification of skeletal muscle. And then exercise 14 is gross anatomy of the muscular skeleton. So naming all of the muscles, being able to identify them, so on and so forth. Here we go. Okay. Oh my gosh. So the first exercise covered is exercise 12. These images should look pretty familiar to you because they are coming from your worksheet. These are the images that you will have to identify on the lab practical exam. So you'll want to be able to identify all of the components of this image here. Again, it is something you've seen before, so go back in your worksheets, go over it. What you should know is, right, the ligament, knowing that the periosteum, that would be the outside of the bone. The joint cavity right here is probably something they would ask you about. And then the way that this could be asked is identify this structure or something here. And then what is contained inside of this structure, which would be the synovial fluid. Additionally, the fibrous capsule you'd have to identify, and then knowing that the fibrous capsule with the synovial membrane is called overall the articular capsule. Below are some images of movement. So I only included a few, but there's multiple that you do need to know. All of the definitions or words that you need to know are here. So flexion, extension, hyperextension, circumduction, pronate, supinate, eversion, inversion, protract, retract, rotation. You're going to need to know all of these, and then in a little bit, I'll show you like specifically how these questions will be asked. So they can be asked in like word form. You know, it can be asked as like what two bones work to, or let me see. I'm trying to think of it. Oh, I just had the question earlier. It'll come up in a little bit. But specifically, so this image here, this lady, she does come up, and there's also another lady, I believe that they use on the exam. It's in, here it is. It looks like this. This is also one of the images that you should see on the exam. I don't know if you'll be able to see it. It's the older lady and this lady that comes up. Just being able to identify the movement that they're doing in the image. This second image here is pronation and supination, so just knowing the difference between the two. The easiest is when your hands are up like this, you're in supination because you can hold a bowl of soup. When they rotate over, so the radius rotating over the ulna, this is pronation. The way that I've heard it is like a professional basketball player, so pro basketball, and they would be able to dribble during pronation. And then we have inversion and eversion over here. Again, be able to identify it in an image. And then some definitions you need to know and be able to differentiate between are sprain, luxation, and subluxation. So a sprain is when ligaments reinforcing a joint are torn. So we see this commonly in our spine, ankle, and our knee. A partially torn ligament will repair itself, but because ligaments are so poorly vascularized, sprains heal slowly and do tend to be painful. And then we talk about dislocations. So first we have luxation. Bones are forced out of their normal positions at a joint. Shoulder, fingers, and thumbs are common, and then the bone ends must be reduced or returned to their proper position. So when a bone pops out of place, just popping that back in. And then we also have subluxation, when bones are not completely moved out of place. So knowing the difference between luxation and subluxation, and then also what sprains are. Okay, and then we start to talk about joints again. So this will come up on the lab exam, both in images like this and in the specific joint models. So you will again need to know the 3 types of joints and then what like the subcategories for each of those. So first we have fibrous joints. These are categorized as immovable joints. These do not move. So once they are in place, they are not supposed to move. The 3 types of fibrous joints are sutures, syndesmosis, and gomphosis. The way this can be asked on the exam is they can give you a image of a skull or a skull model and say what type of joint is the coronal suture categorized as. That would be a fibrous joint because that's immovable. So again, we have sutures, joints held together with very short interconnecting fibers. Once these are sutured up, they should not be unsutured. They should not come apart. We have syndesmosis. These are joints held together by a ligament. So we have that right here. We have the fibula and tibia right here. And here's that ligament holding that together. Syndesmosis. And then gomphosis are peg and socket joints. Again, these are not supposed to come out. The easy example of this is your tooth in its socket. Again, fibrous, immovable. We then have cartilaginous joints. These are slightly movable. We have synchondrosis and symphysis. So the first one, synchondrosis, these are bones united by hyaline cartilage. So an example of this is the epiphyseal plate or the joint between the first rib and the sternum. So remember, your ribs do not attach directly to your sternum. They have to attach via cartilage. So this is an example of that. The way this can be asked is give an example of a cartilaginous or a synchondrosis joint. That would be what you would write. Symphysis, these are a little bit easier. We have the pubic symphysis and then the intervertebral discs. The pubic symphysis is where your 2 os-cox meet in the middle. And then again, symphysis are those intervertebral discs. They cushion your spine together, because if not, your spine bones would just be kind of clanking on top of each other, and that would be uncomfortable. So symphysis, again, are cartilaginous joints. These are slightly movable. They provide for a little bit of movement in between your bones. And then next we have synovial joints. These are diarthrotic or freely movable and allow for a wide range of movement. So again, synovial. And then we have 6 types of synovial joints that we talk about. We have plane joints, hinge, pivot, condylar, saddle, and then ball and socket joints. I did talk about this a lot in our lecture review, so I'm not going to go over it again completely because that is something we already did cover. But specifically for the lab, you are going to want to know like the types of joints that fall under each of these categories. So for the plane joint, we have intercarpal joints, or the joint between the vertebral articular surfaces. So plane joints have flat articular surfaces. Hinge joints, these are elbow joints or the interphalangeal joints. So we can see here that is where the ulna would meet the humerus and allows you to do this, right? Like a door hinge. Pivot joints, this would be the head of the radius with the ulna that allows to move or pivot. We have our condylar joints. These are the metacarpophalangeal joints or your knuckle joints. A saddle joint, this is your thumb. So it is both your carpal and tarsal. And then lastly, kind of the bigger, more familiar joints are ball and socket joints. These are the easiest to identify. We have the scapula articulating with the humerus, and then also your femoral head with your acetabulum of your os coxae. Specifically on the lab exam, you'll have to identify, so they can give you, I don't think I have it out. Oh, back here, we have a, hip joint. You would have to identify what type of joint is this, or name the synovial joint. That would be a ball and socket joint. Same thing with any of these that they can give you. Specifically though, I've seen that one come up. And the shoulder joint. Okay, and that's all I have for joints. Next was exercise 13, microscopic anatomy, organization, and classification of skeletal muscle. So again, you should have seen this image before. We started talking about it a few weeks ago. You will have to identify some of the anatomy of this image. So usually they ask about the coverings. So the first one is right here, the epimysium. This is outside of the muscle, and it's an overcoat of dense, irregular connective tissue that surrounds the whole muscle. We have the perimysium, which includes fascicles. These are within each skeletal muscle. The muscle fibers are grouped into the fascicles that resemble bundles of sticks, which are what we have here. Here's that perimysium. Surrounding each fascicle is a layer of dense, irregular connective tissue called perimysium. So we have right here, perimysium wrapping a fascicle, which is all of this in here. So we have our epimysium and then our perimysium. And then we have our endomysium, which is within the muscle. This is, again, connective tissue that surrounds each individual muscle fiber. And this also has areolar connective tissue. I don't know how in-depth they'll go with the types of connective tissue that is within each of the muscles, but I would think knowing connective tissue in general would be at least half credit. Again, and then we have here a tendon connecting to the femur. So tendon is connecting muscle to what? Is it connecting it to another muscle? Is it connecting it to bone? Bone, yeah. So a tendon is connecting a muscle to bone. What is a ligament connecting? Bone to bone, good. So again, tendon, muscle to bone, ligament, bone to bone. Okay, and then we have exercise 14. Let me go back. With exercise 13, there is a few more images you will need to know, but I do want to focus on the muscles today because I think that's where everyone kind of has the most trouble. So exercise 14 is gross anatomy of the muscular system, which is basically just naming all of the muscles. Some examples of questions that you will be asked: identify the muscles or structure of the abdominal wall, identify the muscles that cross the hip and knee joints, and then that would be labeled A, B, C, D, having to label each of those or name each of those. Or they could just give you no muscles and say, name 2 or 3 muscles of mastication. So there's just different ways that it can be asked. It doesn't necessarily have to be an image of a muscle or a model of muscle and then identifying or labeling what it is. Origin and insertion. Remember, the origin is the more stable proximal attachment point, which would be up here, while the insertion is more mobile, the more distal attachment point, where the muscle attaches to the bone that moves during contraction. So make sure you know the difference between origin and insertion. I think I have an example in the PowerPoint, but what they can do is tell you an origin and an insertion of a bone, and then they would expect you to be able to name the specific muscle. The way they could also do this is give you the muscle and ask for the origin and insertion. We do have a question in the chat. It says, in the past, what muscles have they asked about, or is it random? It is pretty random. They do tend to ask about the muscles that were on your worksheets just because they know that you've already kind of gone through those and studied those. But it's kind of anything is free game. They can ask about whatever they want. But I would specifically look at the muscles on your worksheets. Okay, here we go. So now we're going to get into naming the muscles. So we have muscles of the face, neck, and vertebral column. So let's start with this one up here. These, or this specific image, the muscles, the named muscles of this image have a name, or they're referred to as the muscles of blank. Does anybody know what they are? Mastication, yeah. So this specific image represents the muscles of mastication or the chewing muscles. So right here, what is this named muscle where my pointer is, if you can see it? This is going to be your temporalis muscle. Kind of not something that we think about that would be involved in chewing, but it is. Going a little bit lower down here, this larger muscle right here. What is this one? Masseter, good. And then down here, see if we can see it. This one is going to be your buccinator or your buccinator. The prefix like buccal refers to the cheek, so this is on your cheek side. Let me see if I could change this because it might be easier if I change the color of my pointer. Oh, no, not that. Okay. Okay. Here we go. Okay. Oh my gosh, now I lost it. That's embarrassing. Okay, now on this side over here, moving to the left side. Oh, it only comes in. Okay, I'm ignoring that. Over here on this right side, number 1, this is going to, number 1 and 2 are going to be your pterygoids. So we have a lateral, which is going to be the more superior, and a medial pterygoid, which is going to be inferior. So make sure you know those. They can ask about any of these. They can tell you name 2 of the muscles of mastication. They can give you the temporalis in this specific image and ask you to name the other 2. So just being familiar with all of them. Moving down, let's talk about the muscles of the face. So again, we already named one of these. This is the temporalis. What is this one up here? Number 11. Yes, this is the Galea aponeurotica. It is a sheath of tissue that connects 10 and 2. So let's move to 10. What is number 10? Frontalis, good. And then 2? Occipital, good. So we have frontalis, Galea aponeurotica, and then our occipital. I should have probably gone in order. Let's go to 9. What is this specific muscle? Good. So this is the orbicularis oculi, not to be confused with the orbicularis oris. The way that I always remember it, orbicularis oculi, it's on your eye. So just remember that. Let's see. 8 is getting pretty deep in there. Can we see what that is? Number 8. I don't know if you'll be able to actually see that. Number 8 is kind of directly underneath the orbicularis oculi. This is going to be the levator labii superioris. Again, a little harder to identify, but it is there. 7, do we know what this one is? Maybe a little hard to see as well. Yes. So 7 is going to be your zygomaticus major and minor. I'm not sure if they would ask for a specific one. I would think those zygomaticus would be sufficient. Number 6, we just talked about this one a little bit. Do we know what this one is? Orbicularis oris, good. And then 5, if it's close or if it's on our chin, do we know what this one is? The depressor anguli oris, or actually, which one is this one pointing to? Yeah, this one is the depressor labii inferioris. And then let's see, number 4 is this long muscle. Does anybody know what this one is? Platysma, good. A lot of students get this one and the trapezius confused. Platysma is going to be anterior, or at least from this specific view, it's going to be this anterior one. Let's see, and number 3, so it's past the masseter, so it's deeper. Do we know what this one is? 3? Yeah, number 3 is going to be the risorius. Again, when you are taking your exam, remember that specific models are sometimes deeper or more superficial than others. So you really want to make sure that you can identify maybe some other muscles that you are looking at, just so you can be sure that you're kind of in the right orientation. Additionally, remember it is really hard to like label some of them. So if it is on a model, it's probably going to be something that's easy to label. Okay, let's see. We're gonna move this way. We have number 3 right here. Does anybody know what this one is? Try to think of where this is. 96. Yeah, so this one is that really long one. We can see that it is originating or like ish at our skull, which would be our mastoid process. And then it's going down. Eventually, it will hit our sternum and clavicle. So this is our sternocleidomastoid muscle. And then deeper to that, right in here, number 2, does anybody know what this one is? Yes, this is going to be our splenius capitis, which we will also see in a little bit. Moving to our right, number 1 right here, does anybody know, again, what this one is? This one is going to be our semispinalis capitis. And then number 4 down here is referring to 3 specific muscles that make up our erector spinae group. So we have our iliocostalis, longissimus, and our spinalis. Specifically on the exam, they can ask you to identify the muscles that make up the erector spinae, or they can ask you to identify the 3 muscles and then say collectively, this group of muscles make up what group? And then that would be your erector spinae group. Yes. Which one?
The gastric muscle, yeah.
I don't think it would be visible here. I can find an image though for you to point it out a little bit. Yeah. Yeah, more. I think I have it coming up. And then lastly, again, number 2 right here, this is just another view of that splenius capitis muscle. So again, it kind of depends on the view or the image that you get to identify the muscles. Okay, and then don't forget that you also need to know the origins and insertions. So I just have a few here. We have our zygomaticus muscle, originates at the zygomatic bone. If it originates from somewhere, is that the more movable or less movable bone? Less movable, good. Insertion, skin/muscle at corner of mouth. The function, location is here. I don't necessarily think you need to know this, but it is here. Orbicularis oris, origin, maxilla, or mandible. Again, it specifically depends on your instructor. I know for Mr. Torres, if you wrote maxilla or if you wrote mandible, that would be enough credit for him. Masseter, zygomatic, and then insertion would be the mandible. Temporalis, the temporal muscle or temporal bone, and then the insertion would be your mandible. Okay, moving forward, now we're moving a little bit lower. So I think this is where here what Catherine was asking about. What is number 1 here? This is going to be our digastric. So there we go. Digastric. We're moving towards like our lower under inferior of our mandible. So right here is our hyoid bone. This is where a lot of our muscles attach to. So a lot of this will be, right, we have our thyrohyoid, sternothyroid. So we do have a lot here. Number 4 up here, do we know what this one is? try to think of it, right? We know it's going to be, or it's going to have hyoid in it. So where else is it attaching to? Mylohyoid, yeah. We have our mylohyoid. Let's move down here. Number 6, right here we have our hyoid. And it's attached, it's moving all the way down to our sternum. Yeah, this is going to be our sternohyoid. Let's see. What about number 2 here? We have our hyoid, and it's moving down again here. So what is this one? This one is going to be our sternothyroid, and the one we just talked about was sternohyoid. So it is a little bit annoying, but it does have that discrepancy. And then lastly, we have number 3. We have our hyoid, and we see that it sits on top of our thyroid. So this is our thyrohyoid. Luckily, this specific image, as long as you look at, or if you actually have no idea what to name the specific muscle, we have our hyoid here, and then you just need to see where it attaches elsewhere. So does it attach at the thyroid? Does it attach at the sternum? Does it attach to the mandible? Number 1 was our digastric. In the chat.
It's like those two, right?
Yeah, there has like two bellies. Specifically for these muscles, it would be really hard to ask you on a model, so expect this image to come up. Okay, and then we're going to move to our stomach area, our lower abdomen region. So let's see. Number 1, I think, is pretty easy. It's just this line right here. What is this? Linea alba, good. Number 2 is going to be the specific muscle here. So what is this? Rectus abdominis. And then let's see. I don't know if it's labeled. Number 4 is going to be like this more internal kind of portion here. So which is this one? Internal oblique, good. And then number 5 is going to be even deeper. So what is this one? Transversus abdominis, good. I don't see it labeled on here, but there's these serrated kind of portion. And as long as you can tell that it's serrated, this is going to be your serratus anterior. Let's see. And then we also have down here, we have another aponeurosis, which again is that sheath. This one is going to be the aponeurosis of the external oblique. Okay, moving down again, we are going to start down here. Let's see. Where do I want to start? So let's see, can you guys see, or if you have it on your worksheets, this one right here, this is going to be number 1. Do we know what this one is? It is, try to compare it to this other side of our model, right? We can see one is more superficial. This one is going to be deeper. So what would number 1 be? Number 1 is going to be the pectoralis minor, and it's deeper than this one because this would be the major over here. So this is going to be the minor. This one, I'm sorry, say it again. Major is going to be this one over here. So like your pec, and then the minor is going to be over here. And then is it okay? It might be.
I guess like the label that.
And then 2, on my end, it looks like it's pointing at the serratus anterior. Again, these images are kind of hard to see. Specifically, if they were to ask about 1, they would probably ask on an image. Number 2, the serratus anterior, they can ask on a model. Specifically, George back, is that George? That's not George. Bruce back there, you can see him really good on him. Okay, and then we're going to move over here. So number 3, I don't know if you guys can see it, but it is attached to the scapula at some point or at some landmark. Do we know what this one is here? Can I zoom in? Yeah, I can. This one right here. This is going to be your levator scapulae. So what do we think the function of this muscle is? Shrug your shoulders, so elevate, right? It's in the name. Let's see. Okay, 4 is really small in here, but it is identifiable. This is going to be your rhomboid minor, and then 5 is going to be your rhomboid major. So again, 3, levator scapulae, 4, rhomboid minor, 5 is going to be rhomboid major. And then 6, do we know what this muscle is? This is going to, trapezius, yeah. This is going to be your trapezius. Again, not to be confused, what did I say earlier? With the platysma. Students do tend to get that one confused. Oh, I'll do that. Trap, yeah. Mm-hmm. Okay, we're going to move forward again. So let's start over here. What is this number 8 right here? Deltoid, good. This is your deltoid muscle. Again, this is one they will probably ask about on a model, as well as ask like word questions about. So what is the origin and insertion? Or they'll give you the origin and insertion and then ask you to identify the muscle. Number 9, this is again our pectoralis major. Number 1, what is that pointing at?
That's the one I thought was the Terry's.
The teres, yeah. Mm-hmm. Teres major. I believe so. Yeah. Mm-hmm. Yeah, that is a little weird, the way it's labeled. I would have to double check that one. It's just the way it's labeled. But number 2, do we know what this one is? Yeah. Number 2 is going to be our coracobrachialis. Again, we can see how deep these are. So pay attention to the image that they're using because it would need to be deep to be the coracobrachialis. Okay, and then again, we have 8, which is our deltoid. You can see it both anterior and posterior, so make sure you're aware of that. 7, do we know what this one is? It's another big one. It has like a common name, the lats. So this is your latissimus dorsi. Again, this one is usually asked about. Okay, and then we get into our rotator cuff. You will need to know these. The way to remember them is sits on the shoulder. The way I've seen this asked is they either give you 1 or 2 and ask you to name the rest of them, or they ask you to name all of the 4 muscles of the rotator cuff. So number 3, this is the supraspinatus. This landmark right here is the spine of the scapula. So we're going above that, so superior, supraspinatus. Let's see, 4, we have our infraspinatus. So inferior, supra, infra, SIT. Where are we? Okay, and then let's see. 5, is this 5? Teres, yeah. 5, we have our teres minor. And then 6 should be subscapularis. I don't have it labeled on my image, but that's where it should be. And that would make up the last muscle of the rotator cuff. So again, I've seen this asked last semester, so it will be asked again. They may give you 1 or 2 of them and ask you to name the rest, or you'll have to name all of them. And then I believe so then we have, again, more origins and insertions. The sternocleidomastoid is a little bit easier just because it's in the name. Origin, either the sternum or the clavicle, depending, again, on your professor. Insertion, the mastoid process. Let's see, trapezius, it's occipital bone. You could say cervical vertebrae specifically. This one says C7, but cervical vertebrae or thoracic vertebrae would be fine. And then the insertion, scapula or clavicle. The latissimus major, let's see, lower 6 thoracic vertebrae, so just thoracic vertebrae or iliac crest, so you could also just say pelvis. And then the insertion, humerus, right? So it has all of this whole big definition, but really what you need to know, humerus. Okay, now we get into our arm bones. Okay, so let's see. This is going to be in posterior view. So what is number 1 right here? Triceps. Yeah, this is going to be your triceps brachii. There is like a lateral and long head, but you guys just need to know tricep brachii. So from posterior, let's move anterior. And all we're doing is kind of flipping the image. So what is number 2? Bicep brachii. Good. Okay, number 3, we're going to stay medial, but it's deeper than the bicep brachii. So what is number 3? Still medial. Supinator. I have it being the brachialis. So number 3 in here, brachialis. And then number 4, do you know what this one is? Try to think of it if you are in anatomical position. We're moving, right? It's about here. We're starting to move into our forearm. There's a specific bone that sits when we're in anatomical position laterally. What bone of our lower arm sits lateral? Radius, yeah. So number 4 is our brachioradialis. If we were to not be in anatomical position, that muscle would move to medial, but since we are in anatomical position, it is lateral.
Like more on the forearm or on like the,
Mm,
is it this little tiny thing?
the one that's not labeled?
Yeah.
I actually think that might be the, what's the Iconius or
Oh.
Onconius?
Okay.
Yeah. Supinator. And Anconius. Okay. I'm trying to find, here we are. Okay, so let's move. Is 3 where the elbow is? Yes, that would be where your elbow is. Okay, what image do I want to look at? Okay, so we're moving down to our forearm. Again, we already kind of talked about some of these. Specifically, we talked about this one right here. This one was going to be our brachioradialis because it's going towards our radius. We're getting into like the flexors and extensors. So does anybody know the difference between the two anatomically? So which are located in the anterior forearm when we're in anatomical position? Flexors, good. And so our extensors are posterior. So make sure you keep that in mind as you're doing your actual exam. Okay. So I believe what Catherine was talking about was the supinator earlier. I don't think it's labeled on here, but it should be this one right here. Can you see my, yeah.
Proximal of the forearm.
Yeah, next to the humerus. So let's move this way. This is, again, a deep view. So what is this muscle here, number 9? This is going to be a flexor or an extensor. Flexor. This is going to be one of your flexor digitorums, specifically flexor digitorum profundus. Do you guys remember talking about that one? Okay, and then let's move to number 7 here. Somebody know what this one is? Again, flexor or extensor. Flexor. This one is going to be the flexor pollicis longus. And then let's see, 8. That kind of looks like it's pointing to the actual tendon. I don't think that's pointing to. I don't know if maybe you guys have a different image.
Have it on my where she does the flexor digitorum superficial. Wait, that one was the first one you said, right?
No, the first one was the flexor digitorum profundus.
Oh.
I don't have that one labeled on mine. Pronator quadratus. Oh, you know what? Yeah, the pronator quadratus. Yeah, that's this one. Really kind of hard to see and really in there. Again, they have to be able to label it. Okay, and then let's see what else we have over here. 7 and 8, again, these are the same muscles that we named earlier. So again, this would be the pronator quadratus and then the flexor pollicis longus, just a different view. And then moving this way, again, we have the superficial muscles anterior. So this one in the middle here, number 3, do we know what this one is? Somebody said it earlier. Flexor carporadialis. Yeah, flexor carporadialis. And then let's move down to 4. Do we know what this one is? I know it's getting like really small. Palmaris longus, good. Number 5. This one would be pretty medial, number 5. Flexor carpio-ulnaris. And then 6 is going to be, again, not as medial, but not on the lateral. That looks like number 6. Does anybody have this one labeled? Flexor digitorum superficialis, yeah. So again, these were all of the, or not all of them, but the anterior. So make sure you know, right, flexors are in the anterior forearm, extensors are going to be posterior. Which I don't have all of them, but I do have some of them. So these are going to be the posterior. So does anybody have these labeled? Here we are. So this is going to be number 1. Yeah, extensor carpi radialis longus. Number 2, again, these are posterior, so what should these be? Extensors. Which one for number 2? Yeah. The extensor digitorum. 3. Extensor carpi ulnaris. And then 4. Yes, the extensor pollicis longus again. Okay, number 5, this one is again posterior, and we can see that we have this joint back here. So we have our humerus and our ulna articulating. So what is this muscle here, label number 5? We did talk about it already. This one again is your supinator. Right. Superficial muscles here. Supinator is going to be much deeper. I keep doing that. Extensor carpi radialis brevis. I want to say that's it has like 2, what are they called? Like not heads, but like the parts to it. I don't know if you'd be able to see it, but I'm pretty sure for the exam you just need to know extensor carpi radialis, because there's like specific parts that is the brevis and then another part. You just need to know extensor carpi radialis. Because I'm not sure if you'll be able to see it or if it's labeled. Okay, so then more origins and insertions for the deltoid, scapula or clavicle, and then the insertion, specifically the deltoid tuberosity of the humerus or just the humerus. The function, whenever on your exam, if it asks you to name a function, you're going to want to use the vocabulary that we talked about. So abduction, bicep brachii, again, humerus, there's, again, this whole, like it attaches at a specific part of the humerus, but you just need to know humerus, and then insertion, radial tuberosity or radius. Flexes elbow joint and supinates forearm, so you could say either of those, flexes or supinates. And then this is what I was talking about, where they may give you an origin and insertion and then expect you to know the specific muscle. So they can give you origin, scapula, and humerus. The insertion point is the olecranon process of the ulna. What muscle are we talking about? The tricep brachii. Okay, some more extensor digitorum, originating at the humerus, inserting into like where your phalanges are. Again, specifically 2 through 5, but just knowing phalanges. Tricep brachii, we talked about it, originating either at the scapula or humerus, and then inserting at the olecranon process of your ulna. Palmaris longus, your humerus, and your palmar aponeurosis, or the fascia of your palm. Let's see, tensus skin, powerful forearm extender, prime mover of finger extension. Where does this get? Okay, here we go. Okay, now we're going to start talking about the lower leg, or just your lower region in general. So specifically, we have, just like we had the erector spinae group, or we had our rotator cuff, where we need to know those specific muscles. You are responsible for knowing the muscles of your quadriceps or your quads. So let's all take an educated guess. How many muscles is that for the quadriceps? 4, good. So we have our rectus femoris, our vastus intermedius, which is beneath the rectus femoris, our vastus lateralis, and then our vastus medialis. So these aren't too difficult as long as you know where your model is like in its anatomical position. You just need to remember vastus and rectus femoris, and then you have the intermedius, vastus intermedius, vastus lateralis, and then vastus medialis. The way that I've seen this asked is, again, kind of like the, what was it? The rotator cuff muscles. They give you one or two and expect you to know the rest of them, or name the muscles that make up the quadricep group. Okay, we're gonna look at the posterior legs or muscles of the lower leg. So here we have our, I don't know if you can see, our gastrocnemius, or I've heard it like gastrocnemius. There is a medial head and a lateral head. Obviously, the medial would be towards the midline of your body. The lateral is going to be towards the outside. I don't think this will be asked specifically for which one. It should just be gastrocnemius. And then we have our gastrocnemius tendon, which is also attaches obviously to the gastrocnemius, but that leads into our calcaneal tendon. Does anybody know like the common name for the calcaneal tendon? Achilles tendon, good. And so where do we think this attaches to, this tendon? It's called the calcaneal tendon. Calcaneus, yeah. Okay, this is like, again, a superficial view of the back of our leg. So this would be, if we just opened up our skin, this would be what we would see. In this image over here, the gastrocnemius has been removed, so we can see the soleus. So we can see this is where that gastrocnemius was, but now we took that out, and this is our soleus. And we can see kind of where we are anatomically because it has the head of the fibula labeled here. So we know that this is lateral. So if this is, yeah, lateral, we have our fibularis longus and then our fibularis brevis here. So again, the fibularis, we know that that obviously has to be in relation to our fibula bone. Okay, and then let's see, looking anteriorly, oops. We have our sacrum here with our vertebrae. So that would mean this is our, or one half of our pelvis. Let's see, number 10, can we see what this is trying to point at here? Anybody? So let's see, 11 right here is going to be our iliacus. So 10 is going to be our psoas major. Together, what do 10 and 11 create? Iliopsoas, yeah. So we have our iliacus and our psoas major, and then that creates our iliopsoas. Okay, this muscle here, this is 4, that's going from our, again, pelvis across. What is this one? Sartorius, good. This is going to be our sartorius. What about, we talk number 1 right here? Do we know what this one is? This one kind of has that funky name. Yeah, this is the tensor fascia latte. I always say latte like a coffee, but latte. And then let's see. If we are going, let's move down. So we have our tensor fascia lata here. Let's move to number 2. What is this muscle here? Try to think of where it is in relation to our bones, or, yeah, this is going to be your rectus femoris. And again, right here would be your patella. So we know that the femur is sitting right in here, especially because our what's called pelvis is right here. We know that the head of the femur is somewhere around here. Okay, and then what about number 3? We did just talk about it. We know that it's lateral. vastus lateralis. So that would make number 8 what? Medialis, the vastus medialis. Again, you can see it up here. So this would also be the vastus medialis. What about number 7 in here? Does anybody, this is going to be one of your adductors. Does anybody know which one it is? This one is going to be magnus. So your adductor magnus. Whereas up here, number 5 would be your longus.
Well, they're right, are they called adductor magnus?
I believe so, yeah. So you would probably just need to know adductor magnus. Adductor.
They're divided into brevis and longus.
Okay. Maybe on yours, that's what it says. Yeah, mine says magnus and longus, but it should just be, honestly, I think it could just be adductor.
Magnus meaning like it's
yeah,
all the adductor muscles.
Yeah.
And then it like branches to brevis. Remember seeing the videos from the other professor?
Oh, okay, yeah. Okay, and earlier I lied. This is going to, I thought this was an 8. This is a 6. This is going to be your gracilis. So gracilis, and then this is going to be the vastus medialis. You can kind of see it better up there. Okay, moving this way, we're going to move posteriorly. What is these 2 muscles up here? Gluteus. Okay, we have a, what is this one? Maximus, yeah. This is going to be your gluteus maximus. And what about this one up here? Yeah, medius. That's okay. Let's see. What about, okay, so we know that this is posterior and we're looking directly at the back of our like upper leg. So what would be 5 right here? You know what this one is? Remember, we just talked about like this specific area. Hamstrings, yeah.
Adductor longus?
Soleus. I think this is going to be because it's deeper.
Oh, I have it.
Let's see, we have our gluteus maximus here. So we're going directly beneath, but deeper.
Tendinosus and membranosus.
Yes. So there's a semi-membranosus and then a semi-tendinosus. Yes. So I want to say this one's going to be your bicep femoris. Yeah. Yes. Okay, so I think I have something else too. Yeah, okay. So remember also, don't forget about the quad. You are going to need to be able to identify, if not all of them, at least a few of them. And then we move again into the lower leg, which we did talk about a little bit, just a different view. We didn't get to talk about the tibialis anterior, which is the very front of your lower leg. So pertaining to your tibia bone. Let's see, we have our soleus down here, where we can also see our gastrocnemius. Our soleus, our fibularis longus, here is that head of the fibula, going all the way down to our, what's it, lateral malleolus. Right next to that is our extensor digitorum longus. And then we're back to the tibialis anterior. A little bit deeper, we have our extensor hallucis longus. And then another one you would probably need to know is our extensor digitorum of our foot, or extensor digitorum brevis down here. We have our flexor hallucis longus. And then again, with this one, you would just need to know like your anatomical position, where you are in relation to the model. The what? Semitendinosis. Yeah, I think it would be more, can you see yeah, back here. I think you'd be able to see it on this image. I should have included a picture of that one. I don't think I had one. Oh. Okay, so then we have origins and insertions of our hip and pelvic muscles, our psoas major, lumbar vertebrae, and then the insertion at the iliopsoas tendon or the lesser trochanter of your femur. Again, just femur. Function is flexing, gluteus maximus. I would just remember sacrum for origin, insertion at your femur. And then your tensor fasciae latae, your iliac crest or your pelvis. And then insertion iliotibial tract. And then our leg muscles, we have our adductor longus, origin near pubis symphysis, pelvis, insertion linea aspera of your femur, so just femur, bicep femoris, and then rectus femoris. Again, you need to know the function for each, and you would need to use the vocabulary that we talked about. And then these are the types of questions that you should be prepared to answer. So name the movement indicated by each of the illustrations shown. So flexion, hyperextension, supination, we talked about that at the beginning. Specifically, it's going to be either the lady from your worksheets or the older lady that I showed you guys a picture of. Identify the labeled connective tissue wrappings or structures of skeletal muscle. Those again are the images in your worksheets that I didn't include on here, but also the image of the muscle that you have to know, like the epi, peri, and endomysium. Classify the labeled joints on the basis of structure, so they can give you either the models of the joints or the images like of the sutures, and you would have to identify those. Another one is indicate the type of movement or actions provided by each of the following muscles. So the bicep brachii flexes or supinates, the pectoralis major adducts, the gluteus maximus extends, or the iliacus flexes. Additionally, I've seen they'll give you the action. So they'll give you flexes or supination and then ask you to name the opposite of it. So flex would be extension or supination would be pronation. Okay, and that's all I have for you. I do have the practice exam set up back here. Number 9 is this model right here. If you want to spend some time doing that, or if you just want to study before your exam. But thank you guys.